Endometriosis is a very common condition. It affects younger women, mostly in their childbearing years, and it can be very debilitating. Mostly women will suffer from pain, particularly around the time of their periods, although it can happen at any time in the month. And they may also have difficulties with sex and infertility. This is a very difficult triumvirate of symptoms. It's difficult that they're having pain with their periods and they're reminded every month that they're not pregnant again. And when they do try to have sex, it hurts. This is very distressing. And it's not surprising that people are frustrated when they're suffering from this condition. Additional frustration comes from the fact that women are often misdiagnosed and not referred on to a specialist. I think this is particularly because the symptoms are very similar to other conditions. So for instance, women might have pain and bloating and be labelled as having irritable bowel syndrome without much in the way of any investigation to really look into what the cause of pain is. In general, women will wait for about 4.5 years before they get to see a specialist such as myself. And this is particularly irritating for them when they've been suffering all along, they've been making repeated visits to their GP, and they've really been pushing for some useful treatment. Now, we're not exactly sure what causes endometriosis, but we think it's mainly due to retrograde menstruation. And what I mean by this is that at every period, some of the menstrual flow will backflow through the fallopian tubes into the pelvis, and within it there will be live endometrial cells, and for some reason these are able then to settle behind the womb and around the ovaries and around the ligaments behind the womb. We think the immune system is partly involved in this because it's not properly clearing up this endometriotic tissue that's deposited there. These cells can then be stimulated every month by the normal hormonal changes that occur in the woman, and endometriomas can form. There can be intense inflammation and things get stuck together as a result. This then means that there's pressure within the pelvis, pressure against the pelvic side wall, possibly adhesions around the ovaries and the bowel and the supports of the womb, which means the womb then can't move properly during sex, and nor can the ovaries, and they can become squeezed, which is why it's so painful. So what we have to try and do is to try and correct this problem and also conserve fertility. Now you can imagine this is quite a tall order, because on the one hand we want to remove all the endometriotic tissue that might be surrounded by healthy ovaries and fallopian tubes and a healthy womb, but on the other hand we do not want to compromise the health of those structures at all. Now we don't ever remove the ovaries. We always only remove the endometriosis. We don't remove the womb. We simply try and excise all of the endometriosis that's present and also divide any adhesions that might be there. This is particularly challenging when endometriosis is on the bowel or near the tubes coming down from the kidneys called the ureters. And of course, if it's on the pelvic sidewall, there are also very large blood vessels there, which we have to be extremely careful with. Having said that, we are normally able to clear the endometriosis and greatly improve patients' symptoms and improve their chances of fertility, whether it be through natural fertility or ultimately through IVF. So it's extremely rewarding surgery, both for the surgeon and for the patient, and we expect to get very good results.